Hi, my name is Nicole Urban, and my presentation is on vascular dementia. Introduction. There are several important aspects about vascular dementia that will be discussed. It is important to understand the pathophysiology, prevalence, risk factors, signs and symptoms, assessment, and finally diagnosis of vascular dementia. This should allow for an increased knowledge base. Pathophysiology. Vascular dementia is the result of brain damage from a lack of blood flow to your brain. The reduced circulation can cause a lack of oxygen and nutrients to the brain. This can cause a disruption in thinking and memory. This can also be caused from a stroke or small vessel disease. Prevalence of vascular dementia. In this chart, you can see there are several different types of dementia. 5 to 8% of people 65 years old and older have a diagnosis of dementia. Vascular dementia is the second most common type of dementia and accounts for approximately 15 to 20% of all dementia diagnoses. Risk factors. There are many different risk factors for vascular dementia. Some risk factors are medical diagnoses, such as atherosclerosis, cerebrovascular disease, cardiovascular disease, diabetes, and a history of a stroke. Some other risk factors are from lifestyle choices, such as smoking, alcohol consumption, being of increased age, 65 or older, and also genetics can play a part in having a risk for vascular dementia. Signs and symptoms. There is no clinical presentation for vascular dementia. Typically, it goes based off of signs and symptoms, and those can be very similar in multiple types of dementia. Some in vascular dementia would include problems with memory, confusion, trouble concentrating, unsteady gait, poor organization of thoughts, poor judgment, especially with finances. These are just a few of the signs and symptoms. Assessment. First thing that should occur is a physical assessment by the primary care physician. They should perform the physical assessment, look at the signs and symptoms, and then order more testing based off of those symptoms and labs. Laboratory testing, such as vitamin B12, should be performed, and ruling out infections or other concerning labs. Neuropsychological testing should be done, including a MOCA or a mini mental exam, as well as neuroimaging, such as a CAT scan or an MRI. Diagnosis of vascular dementia. There is no specific test for diagnosing vascular dementia. It goes based off of the assessment findings, signs and symptoms, labs, the imaging, and ruling out other diagnoses. Once that is complete, the doctor can use their clinical judgment and diagnose vascular dementia. Conclusion. We have discussed several important aspects about vascular dementia, some of which being pathophysiology, prevalence, risk factors, signs and symptoms of dementia, how to assess for vascular dementia, and finally, how to diagnose it. This provided information should help with understanding vascular dementia. References. Here are a few that I used for this presentation.